this week we're doing hub on Tuesday, Wednesday, Thursday. Tuesday and Thursday are our initial dose hubs. Wednesday, tomorrow, will be our second dose hub. It's for the people who received their initial dose on February 24th, 25th, and 26th. So we did not call those people to schedule their second dose appointment. But when they left their first dose appointment, they had written on their immunization card the target date for when to return. And so those people will not receive a call to tell them they need to come. But if you had your initial dose from us on February 24th, 25th, and 26th, then your day to come back is tomorrow. So just wanted to make sure we clarified that. The Texas Department of State Health Services announced last week that they were opening up the eligibility criteria to also include those who are 50 and above. And so that opens it up to a new group of people. You do not have to have any other qualifying condition. You just have to be at least 50 years old. So those people are now able to register on our system. We've actually changed the wording for the criteria to include 50 and above, so that you can click that eligibility piece and you should be able to schedule your appointment. So we hope that that will increase the number of people we're reaching, and excited to be able to serve this new population. We actually still have plenty of slots available for both today and Thursday's clinic. So today we had put in, I think, like 1,800 appointments and had only scheduled out somewhere in the neighborhood of 1,250-ish. So still got some availability for today. You can either do the walk-up line, or you can go in and actually schedule yourself in the system and do your QR code and bring that in, and that makes check-in easier. Or you're welcome to do the walk-up line as well. If you're going to go schedule yourself, it's abilenetx.gov/vaccine schedule to schedule yourself. One thing that we've heard a lot of is that there's some misunderstanding about the question in the system that says, have you had a vaccine within the past 14 days? We've changed our process a little bit, and so we're asking people to go in and actually schedule their second dose now. And so when they leave the first dose clinic, they go and schedule themselves, and they're answering that question, yes. But they should not answer that question, yes, if they've only had the COVID vaccine, because it will actually not allow them to schedule, because it's a contraindication in the system to be able to schedule yourself for COVID vaccine if you've had another type of vaccine in the past 14 days. So that might be something like if you have your shingles shot, or if you had a flu shot or something like that, then it's recommended that you wait the 14 days just because of the lack of data just to indicate whether that is truly safe or not. There's not, just because of the lack of data, it doesn't mean that it's definitely unsafe. And you can certainly visit with your doctor if you have a question, because sometimes the benefit of being vaccinated, as opposed to waiting the 14 days, may be something that your doctor wants you to go ahead and get the vaccine. So anyway, just to provide a clarification on that. One of the other common questions, and I've gotten a few emails about this, is people who went in to schedule their second dose and they can't find a clinic that is labeled second dose. So we are not differentiating between first and second dose clinics anymore. We will just put out the clinic dates, and in the system it's going to ask them, is this your first or second dose? And then it'll ask the date that you had your first dose and the kind that you had, so we can make sure that we're doing the same type of vaccine. But anyway, you should be able to just schedule yourself for any day that is available for a first or a second dose. We still don't have any Johnson & Johnson. That's been another popular question. I think there are some people who are waiting specifically for Johnson & Johnson. We continue to request it each week, but we have not been allocated any at this point. There were a couple of local providers that got some, but I think they were gone pretty quickly, and I have not heard at this point if anybody locally has gotten another allocation, but we have not at the health department. But we are actively requesting it and trying to get some on board. Another very popular thing now that it's been opened up to the 50 and older group, this is a group that's still working. And so we've had lots of requests for after hours or weekend clinics. Just know that we are working on that in a couple of different ways. We're looking at potentially securing a third-party vendor to supplement what we're doing. But also working with staff to try to coordinate doing a weekend or an after hours clinic. So more to come soon on that. We do want to try to make it available for people who it's not easy to get off of work. So we'll definitely provide that opportunity soon. And then also just a quick note, I'll be reaching out to the local providers here in Taylor County, but if there are any local pharmacies or providers that have enrolled as a vaccine distributor with the state of Texas, that we've got some extra doses that we could transfer over to others, and that way we can kind of share the load with maybe people who are more comfortable going to their own pharmacy or to their own doctor. And so we are willing. We only have Pfizer right now. We do actually have, I think, 60 doses of the Moderna, which we're not receiving Moderna anymore, so we're hesitant to give that out as an initial dose. But if any other local provider would like those 60 doses of Moderna, you are welcome to reach out to me, and I will see that those get transferred over to you. But I think that is all that I had on my list of things to talk about. Any specific questions that y'all have?
And I've seen obviously in recent days a lot of posts saying, hey, like, 16 and up, you guys can all come too. We've got all these doses. There's not a wait. Talk to me a little bit about that, and how are we able to do that?
So when we have doses that are set to expire, we try to get them out quickly. So we don't screen for eligibility when we've got doses we need to get out the door. We'd rather put them in an arm rather than to try to screen for eligibility. The state is absolutely 100% on board with that. They would rather us put that in a willing arm than to throw it away. So when we have things like that, the other reason we do that is the state automatically sends us an allocation each week for our hub, and they want us to distribute all of that within a week's time frame. And if we set up appointments and we don't have the kind of response that we wanted to have in order to get those doses out the door, we open it up to anyone and everyone. So those are a couple of the reasons why. I know you'll hear a lot of people say, well, that's not fair because I or my loved one have not been vaccinated yet, and so those people can't get in line in front. And I would just respond to that and say, we have plenty of opportunities to enroll, to schedule yourself. If you can't do it online, you can call the health department. Someone will call you back and get you enrolled. There's plenty of ways to, and we've got the walk-up line. So there's plenty of ways to obtain a vaccine. And when we still have openings, that, it's hard to sit on those. And I don't want them to sit in our freezer. I want them to be in people. So I'd rather give them to anybody who's willing to have one than to let them sit and wait on people to schedule an appointment.
The other thing I noticed, I think it was in the last week or so, you were looking for volunteers. How's that going? Do y'all still need some more volunteers?
We always need volunteers. We need both clinical and non-clinical volunteers. Hendrick Medical Center has been really good to share their resources with us in terms of clinical vaccinators. We've got some retired folks who come and volunteer with us, who have been so kind to do that each week. And we've got our own medical staff, and we've got a lot of students from the local nursing schools and the PA school. And so we've been able to kind of piece it. And also I forgot to mention the fire department. They've been sending their EMT personnel every hub as well. So we're already tapping into our own resources. But anyway, we could still use the non-clinical volunteers. There are clinical sign-up sheets, so I can certainly provide those to whoever would like them. And you basically just plug yourself in.
Very cool. On the days that we saw, the open for everyone.
Mm-hmm.
I don't know. I mean, I don't know if you have ages or anything, but were you seeing a lot of younger people, like even 16, 17, 18-year-old?
Yeah, we had a really young crowd yesterday, which was great. Happy to be able to vaccinate anybody who wants it. We did see a lot younger crowd yesterday.
Very good. And how many people are left on the wait list right now?
So we sent the last one-time use links today to finish out the entire wait list. So everyone has been contacted at this point from our entire 25,000 original wait list. Yep.
Well, great job on that. So, and I'm done with all my questions.
Okay.
How many vaccines, how many doses were distributed to people in that walk-in clinic?
353, I think it was, or 354.
With Travis's question, I was curious about how the waste is going. I know initially you guys were doing really well on not having any waste. And so have you had that same level of success with not having to waste doses?
Yeah, so yesterday's quick dose handout was in response to, I think it was Haskell Memorial that had a bunch of doses that needed to be used. And so they originally said, I think it was like 150 doses or so. It ended up being about 350 doses. So those were ones that we were going to have to throw out if we did not use them, and we used them within the proper time frame. So we still at this point have not had hardly any waste to speak of.
And then with the second doses and the people not getting called reminders to show up, are people showing up as scheduled? Are you having a lot of missed appointments?
Both. We have people who are confused, who are waiting for a call. And then we have plenty of people who got the message. We've actually started just doing a little printout that they take with them to tell them how to schedule their second dose. But kind of during that transition of, we'll call you for your second appointment to no, just show up on this day. There were a few people that, probably didn't get the message or whatever, but they will eventually reach out and ask that question when they realize they didn't get a call. So for the most part, I hope that we're catching most people, and but if not, they'll eventually wonder why they didn't get a call, and they'll reach out. So that the new way to do that is to have them schedule themselves in our self-scheduler.
And then you mentioned that you're not going to be differentiating between first and second dose clinics, but this week there is first and second dose. So is that starting next week or?
Yeah, I think in the system, the way that they're labeled, I can't actually remember if it's next week or the week after, where we don't label them anymore as like a first dose. And we had sent people home with the exact date that they needed to come back on their card. And so I don't remember if that starts next week or the week after.
Okay. And then my last question is just with the idea of you guys trying to schedule like evening or weekend appointment or clinics, would you also encourage employers to consider giving their staff and employees time to go get vaccinated because it's in their own best interest to have a vaccinated staff?
Yes, and there have been a lot of people who have said that, their employer was really great about letting them run and go do that. The good thing about our flow is that it does not take long. We've had a lot of people say they were in and out within 30 minutes. Because there's usually not a line. I know I've talked about if you get here super early thinking you'll miss the line, you actually create the line. So actually the worst time to come is first thing in the morning at 7 or 7:30. That's probably the longest wait time there is all day. But other than that, throughout the day, there's typically not much of a wait. It does not take very long. It's a pretty well-oiled machine. And so if they have only a 15-minute wait, they should be in and out of here within 30 minutes. Now, there are some exceptions to the rule. There are times when things get backed up, but it's pretty infrequent. But yeah, it would be great if employers would allow their people to take a quick break and go do that. And people can do it on their lunch break as well. But there are some people I know that when you're in the service industry, you can't just go take a quick break and be gone for 30, 45 minutes. So I understand that as well. And that's why we want to try to do what we can for those people.
Annette, as far as the opportunities that are open to everyone, how is the public best made aware of those? Are those things that you post on Facebook or the city site, or how can they be watching out for those things?
I shoot it over to Mari, and Mari magically makes it happen. Maybe Mari's the better one to answer that question. How do you do it, Mari?
Yeah, and you guys too, tell me what you think might function better, because it's sort of a fast-paced thing. If there's 300 vaccines, I sort of hesitant to put out something that's too big, so then by the time they see it in their feed, or it's late. So I've been just putting out just text posts on Facebook and I guess Twitter off the city's page and health district's page. So then you are in this place of having to just watch and catch that. I guess I don't think enough people know to go to the city's website if I posted it there necessarily. Like, oh, the line's now open. We were talking about this. I would love for it to be something where there's like a vacancy, no vacancy sign that lights up, and people know to go there and check and see like, here, we're open, let's go. So not having an answer to that entirely. It's just been a matter of, I'll just post, text, like you've seen, like the just text. There's not even bothering to go through making a graphic because it just wastes time, right? Just, hey, walk-up lines open now, this many doses, and hoping people can kind of judge for themselves. Okay, if there's only 200 and it's 3:00, this was posted at 9, there's probably not anymore, kind of thing. So absolutely open to what you guys think might be the better way too, that folks are getting this information, but it's just tricky because it's so fluid, right?
Yeah, that's fine. Yeah, for Annette, just overall, how has demand continued to be? Would you say that you're seeing consistent signups and consistent interest, or has it sort of dropped off over time, or as you filled your list, or what would you just see in terms of that?
We're kind of unsure at this point whether the opening it up to the 50 and older group will kind of have a resurgence of interest and scheduling of appointments. Like I said earlier, we've got those 2 clinic days for initial doses this week. If we only had 1,250 sign up for today when we had 1,800 appointments, and we've only got 300 scheduled for Thursday when we also have 1,800 appointment slots available, we're unsure if that's just because we've targeted the majority of the people who qualified previously, and now that 1C is opened up with the 50 and older, will that generate another group of people who can schedule now that they know that? or are we going to continue to struggle to fill those appointment slots? And if we do, I will tell you that we will quickly open it up to anybody and everybody. The last thing I want to do is have doses sitting in the freezer when we've got people within our community that want to be vaccinated. So if we don't fill those slots for Thursday even, and they are not full tomorrow, we'll put out the message that says, if you want a vaccine, go ahead and sign yourself up as long as you are. We have Pfizer this week. And so if you are 16 and older and you're interested in doing that, sign yourself up.
I just wanted a quick clarification. The doses, the 354 doses from the other day, they came from Haskell Memorial.
Haskell Memorial. Mm-hmm.
So they transferred them over to you because you were better able or more equipped to distribute those?
Yeah, I think that they were just concerned they wouldn't be able to get them out within the deadline and would have to waste them. And of course, you know, everybody who's signed up is committed to getting them out into bodies. And so they reached out to us knowing that we've got a good network of people, and we were able to do it. So I think it was a great call on their part to not waste them and to get them to us.
Thank you.
Mm-hmm.
I know you said before that you guys contacted everyone back that was on those lists. So are you guys done with like the demographic, like that first 1A, 1B list, or are you guys still waiting to hear back from those people who need to get their vaccinations?
Well, they were sent one-time use links. And so that allows them to go in and schedule themselves directly using that one-time use link. Have we finished with 1A and 1B? I have no idea. I don't know who's out there who still is yet to be vaccinated. I think that we feel pretty confident that we've gotten the majority of the people who want to be vaccinated. And of course, you have some people who don't want to, or for whatever reason, are waiting on the Johnson & Johnson because they may have some sort of medical condition and their doctor has advised them that they think the Johnson & Johnson would be a little bit better, less likely to cause any sort of, you know, major allergic reaction because of something they personally have going on. And so I think at this point, basing on the response that we've had, I think we've gotten to the majority of the 1A and 1B people in our community that want it.
I was curious, you said you're trying to get the Johnson & Johnson vaccines, and is there a specific reason that you're trying to get those? Is there something that makes those, I mean, I know they're one dose, but is there something that makes those more attractive to some people other than what you were just mentioning with allergies?
Well,
is there one that's not made in egg protein? Because a lot of vaccines are made in egg proteins and some people can't get any vaccines that are made in egg protein. So is the Johnson & Johnson one for people with egg protein allergies?
Yeah, I would have to have some information in front of me in order to be able to answer that. So I don't want to say something that is wrong. But I will say that there have been people who have expressed that they have just an aversion to getting a vaccine in general. And they don't like the idea of having to come 2 different times. They already get very anxious about having to get a shot. There are quite a few people, even when they show up, I mean, they're powering through their anxiety about getting a shot. And so that one shot, as opposed to 2 shots, is much more appealing to those particular people. And so that's something that I have heard fairly frequently. So that I think there'll be a group that just likes the idea of one shot only and having it done with. So we always say whatever shot you're willing to take is the best shot for you, provided there's no other medical issues going on. But I think that really, it truly is as simple as that. They want one shot, not 2.
We're getting a lot of questions regarding the software. Can you tell us if the city got a grant to cover the cost of the software?
We initially, when I applied for a grant that was available through the Texas Department of State Health Services, I had put on there that we would use that grant to cover the cost of it, even though it wouldn't cover the entire amount. but it took so long in the approval process for that, that now that that has been approved, which we haven't actually received the grant documents. We can't go back and do something retroactive that's already been purchased. And so we did have to use city money in order to do that. My understanding is that it came out of the minor improvement fund. And the vendor did give it to us for less than half of what I know other communities paid for it. So we got a great price break. And we did have to pay for it out of city funding.
So I guess people are upset that, the money is being spent and, people are still being allowed to walk up. What would you have to say to those people who, are frustrated with everything?
I would say that it always looks much different when you're on the other side of having to plan things, when you don't have access to all the information to the reason why decisions were made from an administrative standpoint. And so I know that, there's always going to be criticism no matter what decision you make. We are doing the best that we can. The end goal is to get shots in arms. And if we don't have enough people scheduling themselves because they don't have access to the internet, they don't know how to navigate the internet, and it may simply be that they didn't know whether they were going to have the day off or not. Maybe they have a job that's PRN, which is, like I call you when I need you. I had a random day off. I'm able to come now. Or they have young children and like, okay, everything is going well. Right now is the perfect time. It is what it is. I'm not going to change any of that because it's working for the people who need that. So I think it's been a good decision.
And my last question, do you think people in Abilene are being complacent with getting vaccinated right now?
I don't know what the thought process is for a lot of people. The vaccines are not mandatory at this point. I think that we want to educate people. We want them to have the information they need to make an educated decision on their part. But in the end, it's still their choice. We want to make it available for those who want it. As public health, we want to encourage people to get it. We want to encourage them to continue to do all of the things we're doing to prevent the spread. None of us want another resurgence of COVID-19. I think that's at least something we can all agree on. And so however we get there, whether we continue to wear masks and social distance and stay away from crowds and things like that, or we get vaccinated and we achieve some sort of herd immunity, hopefully we'll get to that point.